concerns and anxiety during disruptive times can be overwhelming. There is always light at the end of the tunnel. Take care of your mental, physical, and emotional health for your sake and for the people around you. Take deep breaths, meditate, eat healthy, exercise regularly, get plenty of sleep, and connect with others. You deserve to be well. When in crisis, call 911. Otherwise, contact a crisis or distress center near you. This message is brought to you by the Transformation Institute for Leadership and Innovation and other persons.
The best gift you can give your family and the world is a healthy you. Don't let your health take a back seat. Join us for a webinar on the pillars of health during a pandemic. Panelists, Dr. Chris Morgan, chiropractor and founder of Black Health Alliance. Abby Ayoola, author, nutritionist, and TV host. And Wayne Williams, celebrity trainer, fitness coach, and TV host. Moderated by Nicole Wong, health and fitness expert and pro bodybuilder. This is part of the Community Resilience Program. Visit transformationinstitute.ca.
Hello and welcome to the 4th edition of the Community Resilience Webinar Series, an initiative of the Transformation Institute for Leadership and Innovation. I am Patricia MAWA. Today we're discussing the topic, the pillars of health during a pandemic. Now, statistics have shown that people of African heritage have been disproportionately affected by COVID-19. For instance, even though they make up only 9% of the population of the city of Toronto, they account for 21% of the total positive cases reported for COVID-19. This is an alarming number. Now, today we have some experts who will be sharing ideas on how we can stay healthy during this period. Now, before we get started with the panel discussion, I would love to introduce our moderator for today's event. She's a health and fitness expert, the owner of Simply Fit, and a professional realtor. She's helped individuals to achieve their fitness goals, and for the past 10 years, she's worked with virtually everyone from professional athletes to busy working moms, and her goal has been to simplify and actually streamline the process of achieving optimal health. And many people do not know this, but she's also a pro bodybuilder. I'm talking about Nicole Wong. Welcome, Nicole.
Hi, welcome everyone. Good evening. Thank you for joining us for today's webinar, The Pillars of Health During a Pandemic. Before we jump into the conversation, I would like to cover a few housekeeping topics. So today's webinar is being recorded and televised. We will share how to access this session after it is over. We welcome you to revisit the content and share it with your friends and colleagues. We also invite your comments and questions. So please place all your questions in the chat box. Once we get to the Q&A portion of the webinar, I'll look over the questions and I'll pose them to the panelists so long as the time permits. Okay, so we have several questions tonight that have been generated that we will be posing to our panelists. So as a reminder, if you have any questions, please do not hesitate. Put them in the chat box and we will address them during the Q&A portion of tonight's webinar. Okay, so right now we're going to play a couple of videos. Okay, the first one is a message from Mayor Tory on Black History Month, after which we will watch a bio video of Moses A. MAWA, president of the Transformation Institute for Leadership and Innovation, CEO of AFROGLOBAL Television and Silver Trust Media. Moses will say a few words after the video plays before we get into our panel discussion.
Hello, I'm Mayor John Tory, and I'm proud to recognize and celebrate February as Black History Month in the City of Toronto. This Black History Month feels a bit different than the ones we've celebrated before. The past few months have not been easy for Black Torontonians. We've witnessed horrific incidents of anti-Black racism abroad as well as here at home. which is why acknowledging this month is more important than ever. COVID-19 has heightened the existing social and economic inequities that exist within our city and within marginalized groups in our city. And I know that the overwhelming sense of grief and frustration and pain felt during the summer of 2020 continue to burden the hearts and minds of far too many. There is no denying that the current times have been challenging, and yet we continue to see demonstrations of strength and of ingenuity and creativity and resilience and resistance from Black Torontonians. In the last year, we've seen tens of thousands of people who took to the streets to call for the end of anti-Black racism, a movement that was strong across the world and that covered a very wide consensus of our population. And we've also seen many community leaders who've amplified the voices of marginalized and vulnerable among Black communities. In response, much has been done and accomplished, but so much more needs to be done, and this has only inspired us to do more. And we are committed to doing so. I encourage non-Black Torontonians to learn more about anti-Black racism, the many ways in which it hinders the lives and the health and the overall well-being of Black Torontonians, and more importantly, learn ways for you to also take part in the fight against it and to be a better ally. As mayor, I remain resolute and firm on my commitment to tackling anti-Black racism within our institutions and our society. This is a critical part of how I honor the history of Black Torontonians and Black Canadians. Anti-Black racism and racism in general has no place in our city. All of these Heritage Months are about us getting to know more about each other. This is a must in the most diverse city in the world, because history shapes who we are, for all of us. It offers us help in ensuring we can support each other and, depending on the circumstances and experiences we've had, adjust and make changes to that kind of support. It teaches us about the good that we want to see repeated and the bad we don't ever want to see happen again. And so to our Black Torontonians, happy Black History Month. And to those Torontonians who are not Black, please go online and participate. You will learn something, as I certainly have every single year during Black Heritage Month, and it will help us to continue to build a respectful, embracing city that is the envy of the world.
Moses A. MAWA is the president of Silver Trust, AFROGLOBAL Television, Destiny, and the Transformation Institute. He is the architect of business, media, ministry, and social innovation brands, including the Crossover Mentorship Program. Moses co-founded the Marcus Garvey Institute with Dr. Julius Garvey, son of the legendary Marcus Mosiah Garvey, and their associate, Michael Dawson. As a film and television executive, Moses has produced Synergy, Standing Ovation, The Minister, the Omabella drama series, and contents for other private and public sector establishments. His Excellence Awards initiative has honored Dr. Martin Luther King Jr.'s daughter, Bernice King, Bob Marley's wife, Rita Marley, Nobel laureate, Professor Wole Soyinka, Jamaica's first female Prime Minister, Portia Simpson Miller, South African music superstar, Yvonne Chaka Chaka, and others. The Transformation Program has awarded many Canadian leaders and innovators. Publisher of Envision, Destiny, Legacy, Diversity, Excellence, and the Discover magazine series, Moses has authored the 150 Extraordinary Canadians Legacy book with his wife Patricia, the foreword by Prime Minister Justin Trudeau. In 2016, Moses and his team launched AFROGLOBAL Television, a 24-hour super channel that informs, empowers, uplifts, and entertains with great programming. Moses received the York Regional Police Civic Leadership Award, Real World Visionary Award, the Harry Jerome Media Award, Toronto Police Community Service Award, and the Queen Elizabeth II Diamond Jubilee Medal. In 2013, CNN featured Moses and Patricia in a half-hour worldwide television broadcast, calling them the Power Couple. In 2019, Moses participated in the Royal Canadian Navy's leadership program. A proud husband and father, Moses holds a BA degree in film studies from Carleton University, among other achievements and honors.
This is actually quite, an exciting initiative, and for today's program in particular, it is actually going to focus on strategic solutions in regards to health and wellness during such a time as this. Quite excited, particularly about the panelists who are actually going to bring a lot of insights regarding virtually everything from nutrition to exercise to everything that we need to have in place in order to be healthy and to be well at such a time as this. The Community Resilience Program is actually presented by the Transformation Institute for Leadership and Innovation, the Canadian Red Cross and the Government of Canada, AFROGLOBAL Television, and Silver Trust Media. I would also like to let you know that we are actually on social media. So if you're on Facebook, please, connect with us. We are also on Twitter, on Instagram, on LinkedIn, and YouTube, and some other, platforms as well. And lastly, I would like to just give you a little bit of information about what the Transformation Institute is all about. For those who do not know, our vision is actually to unlock the impact of good leadership and to accelerate positive change through innovation. The Transformation Institute for Leadership and Innovation has been established with the mission of improving lives for personal and collective success. And I would like to just thank you so very much for being a part of this event today. Enjoy the evening, and let's continue the conversation.
Wow, that is just amazing. All right, so now it's time to get into our panel discussion. Our topic this evening, the pillars of health during a pandemic. Let's meet our amazing panelists. First, Dr. Chris Morgan is the founder of the Black Health Alliance, a charitable community-based organization that this year celebrates 21 years of working in partnership with community, government, health providers, and social services to improve the health and well-being of Black communities. Professionally, Dr. Morgan is a chiropractor and clinic director of Morgan Chiropractic and Wellness, a family-oriented multidisciplinary clinic in North York. Dr. Morgan was the recipient of the 2020 Ontario Chiropractic Association Community Service Award for his efforts in developing and leading initiatives that address underlying social and economic factors that influence health. Welcome, Dr. Morgan.
Good evening, everyone. Thank you very much, Nicole.
Good evening. Next is Abby Ayoola. Abby is a nutrition expert and an entrepreneur that educates people on living healthy. A mother of 5 lovely children, Abby strives to live a healthier life for herself and for the sake of her kids. Her dedication, passion, and down-to-earth attitude has inspired people to completely change their lifestyles in healthier ways and encourages better well-being. She loves to eat healthy, loves to travel, try new things, and in the process, inspire people to do the same. Welcome, Abby.
Thank you, Nicole, for having me.
We are so appreciative that you are here. Thank you for being here. And last but not least, our next panelist is Wayne Williams. Wayne is dedicated and focused on fitness education. His company, Buff Boy Fitness, promotes a different way of thinking about fitness, which includes education about nutrition and encouraging positive self-image. Since its creation in 2014, Buff Boy Fitness has trained politicians, actors, media personalities, and singers. Welcome, Wayne.
Hi, thank you so much for having me. I'm so excited for today.
I am also so excited to get started with our discussion. I will be posing some pre-generated questions to the panelists. Please remember, to all of you that are watching, to post your questions in the chat box for the Q&A portion of this webinar. Okay, we will discuss your questions later on. All right, so first question, what has been the hardest part of this pandemic for you when it comes to healthy living, and how are you coping with it? I'm going to pose this to each of the panelists. Who would like to go first? Okay, Wayne.
Okay, so the hardest part for me is not actually being in a gym and socializing with other people. You know, like it's really hard because, you know, we are a social we are a social society. And especially as us people, we like to, like engage with other people, shake hands, work out, with other
Yes.
people. But when, this pandemic hit, it kind of isolated everybody for their own safety. However, it's a lot to get used to.
Yeah, I agree. I agree with that. I mean, I think one of the best things in the fitness community, I think a lot of us like actually the interaction. Like when you go to the gym, it's nice to see friends and people with that are like-minded. So who's next? Who wants to answer next?
I can go next.
Okay, great.
So for me, the hardest part has been the fact that I have 4 out of 5 kids in school. And
Wow.
lately, they've been forced to go online. So trying to keep up with the different schedules, the different schools, the teachers, and everything all together has been really challenging for me because it's a lot to be in your house 24/7. You can't go anywhere. Everywhere's locked. And you and your children are just in the same space 24/7. So that has been the hardest part for me, for sure.
Yeah, I mean, I can relate. I don't have 5 kids, but I have 2. And it has definitely been a challenge, I think, as a health professional, but as a parent, then having to take up the role of kind of being a teacher as well. But I commend you for 5 kids. That's amazing. You go.
Only God helps me out. That's what I have to say.
Oh, yes. Okay. Yes, his grace is sufficient. All right. Dr. Chris.
I would really reiterate what both Wayne and Abby have said. The isolation and not being able to do the type of things that we enjoy doing, getting together. Typically, my household with my family, we're usually active with the kids and programming and so forth. And we've had to be creative to try to keep our motivation and keep our well-being and our sanity. It has created some opportunities, but certainly not being able to do the things that we, the holidays, I would say, especially, Christmas and so forth, and all the holidays, we usually have a lot of gathering of family around, and not being able to do that in the way that we're accustomed to was a bit challenging.
Yeah, I understand that, but it definitely, these unusual times call for creativity for sure. And we will talk a little bit more later about maybe what some of you guys have done to still remain sort of interconnected, to keep your energy up, to remain positive, as we're kind of in isolation, right? But this next question is for Abby. Given where we are now as a community, what are some ways we can maintain or start living a healthy lifestyle?
Some ways that we can start to live some healthy lifestyle is to create healthy habits. So the first thing you can do when you wake up is exercise, okay? Exercise in the morning helps you to set your day in a perfect way. The reason why I'm saying that is because even though the gyms are closed right now, but you can still exercise in your house, in your condos, in your apartments, or even go for a walk or a run around your neighborhood. There's so many things that you can do. Even turn on a YouTube video, like an exercise video, and go along with the instructions. So those are things you can do to just get your body moving. Because when your body is moving, then your mind gets to start acting right, and then it sets you up for the day. And the second tip will be to work on your spirituality. It's very, very important that you believe in something higher than yourself, because that helps you with your mental and your emotional when you believe in something higher than yourself. So that can be Jesus, God, if you're Buddhist, or if you're Muslim, it doesn't matter what religion you are, but just work on your spirituality, and that helps out a lot. And do some affirmations. Affirmations are so important that it's whatever comes out of your mouth becomes what happens to you. So you have to be very positive. You have to say, I am great. I am working on being the best version of myself. I deserve to be happy. Stuff like that. When you say it out to yourself, then you start to believe it and you start living that way. Okay? And the other tip, it would be drink water. Water is very, very important. I know we're in the winter season now, so it's hard to drink water because you don't feel thirsty as much as if you're in the summertime, but you have to make sure you drink water. And here's a tip I have for you. Drink at least 2 liters of water. So in the morning, have like 2 cups of water, so 500 ml of water before you even eat breakfast, okay? And then after you've eaten breakfast, so half an hour after that, drink another 500 ml of water. Then after lunch, drink 500 ml of water. And after dinner, the same thing. So that leads up to 2 liters of water without even you knowing that you're drinking that much water. So it's all about putting everything into steps and places so you don't feel overwhelmed at once. Like, oh my gosh, I have to drink 2 liters of water. Oh, you know, so you have to put everything in place, and that's how you would know that. That's how you'll be able to do it. Like just small baby steps. You know, you don't have to take a huge step, but small baby steps will help you out. And just get ready for the day. I know right now it's hard to get up from your bed and get ready and be happy and stuff, but just have to have in your mind that, okay, you know what? I'm going to get up, I'm going to brush my teeth, shower, and get ready for the day. I don't know what I'm doing, but I'll still do it just to give your mind a little bit of boost. And then make sure you don't procrastinate. That's very, very important. If you have something to do, set your goals and make sure you do it. Don't procrastinate, because when you procrastinate, then you don't get anything done. And then you just feel like your day has gone and you're like, oh, what did I do today? Oh, okay. But so make sure you don't procrastinate. And the last thing is get yourself a gratitude journal. It's very, very important to write down what you're grateful for. So that way, when you read back your journal, you can see that, you know what? They say count your blessings one by one. So when you count your blessings and you see that, you know what, I am blessed, then anything that happens to you that day or the day after, it won't affect you as much, because you know what you have and you know what you've been blessed with. So those are the tips I have for you to stay healthy during this time, because that covers your physical, your emotional, your mental, and your spiritual aspect of health. So just follow those tips and I can assure you, you'll be healthy.
That's amazing. Those are amazing tips. I hope that everyone watching is taking notes because these are amazing. And I love that your approach is so holistic, because, you know, being healthy is not just about diet and exercise. There's other aspects to your health. Like you mentioned, the spiritual health, the mental health. And I love that. Thank you so much, Abby. Thank you. So this next question, thank you. This next question is for Chris. Now, many people sit at their desks all day working from home, right? What are some factors that people should keep in mind if they're working a desk job?
That's a good question. And I've had, particularly during the pandemic, I've seen an increase in the number of people coming into my office as a chiropractor, with everyone sort of working from home. And, you know, so people are working with the laptop with their legs crossed on their bed, they're at the dining room table, they're on the floor, they're all over the place. And, you know, of course, these arrangements weren't intended for, you know, being there for 6, 5, 7 hours or more per day. And so I see a lot of tension and strain of people coming in their shoulders, in their back, and in the neck area. And so what I try to do is advise them about trying to, sometimes a sit to stand desk is something which can be put in place, which allows you to stand sometimes. Sitting has now become really one of the most almost one of the worst things that you can do for your body, next to smoking, really, because it has it begins to deteriorate and work on the ligaments and support structures of your spine. And so one tip that actually one of my patients gave to me is that she sets on her phone every 30 minutes a little reminder, just a bell goes off, reminds her to stand up, to stretch, move around, take some breaks and so forth. I find a lot of people are in a slouch position. They're bent over and they're working away. And before they know it, several hours have gone by. They haven't taken a break. They move to stand up and there's aches and pains and in the neck and back and shoulder area. So advice I always give them is that our posture, we have to be aware of our posture in everything that we do: sitting, sleeping, standing, bending, working. And proper posture, ideally you have a good chair to sit in, where your back is being supported by your chair. You know, our whether we're using our handhelds or our devices, we don't want our heads bent forward. We want to bring the device up to eye level, so that we have our neck and our spine in a proper position. If you're reading books, or students having a book stand or an easy reader, these are some of the things that are going to support your posture. It'll minimize the stress on the joints and help to alleviate some of the pain and so forth. And take those breaks every 30 minutes, even if it's just a short break, to stretch and move around. Drink some water, as Abby said. Those are all important things.
I absolutely love your tip about standing up every 30 minutes. I mean, that's amazing, right? I find that just naturally, like when I sit for too long, I can feel like and I don't feel as energized, right? And it's just like, but it's good setting that reminder just to get up and move around. It kind of just helps you to shake off, the stiffness, right? That's amazing. Thank you so much. Our next question is for Wayne. So Wayne, because of the lockdown, many people can no longer visit the gym. What kind of physical activity can one do while the gyms and exercise facilities are closed, especially for those who do not work from home?
Okay, really, really good question. I have a video that shows all the workouts that you can do at home. Abby and I kind of put it together. But basically, do you know what calisthenics are?
Yes, I do.
Okay, so calisthenics.
Tell us all about it.
Okay, so calisthenics, for all of those that don't know, calisthenics are body weight exercises. So for example, what you can do are push-ups, you can do sit-ups, and for the more advanced people, you can do pull-ups. Now, sometimes we might not have the facility to, go and do all the advanced workouts, but if you could stick with body weight exercises, including some cardio, like going for a run or walk, like power walking, things like that, even getting into squats, lunges, and things that don't really require a gym, you can still maintain and have a really good, healthy, and strong body. So, calisthenics, any body weight exercises that you can do, I believe that, that will help to keep you strong during this time, even though we can't hit a gym. And, here's a couple exercises that Abby and I have done.
Ooh, amazing.
I'm Abby Ayoola.
And I'm Wayne Williams.
And we're the hosts of Synergy, which is an original AFROGLOBAL television show. And today we're going to show you some simple exercises that you can do at home, your condo, or anywhere that's simple, effective, and safe.
That's right. So if you have a little bit of space around and some things and some items in your home, then you can do it anywhere.
That's right. So let's get started.
How do you feel?
I feel great.
Oh, that's good. And you can do this at home too. You might not have any access to a gym right now, but really anywhere could be a gym. So you just gotta just get out there, get that right motivation, and stay healthy, stay positive, and just remember that it's difficult but not impossible.
Yes, and we'll get through this together.
Yes.
Oh, I love that, you guys. That's amazing. And just for everyone who's watching right now, Wayne and Abby are married. Okay.
Hey.
So those 5 beautiful kids, they share together. Okay.
Yeah.
Which is awesome. Thank you so much. I am definitely, that was inspiring to me. Thank you.
Gotta stay strong, you know?
For sure. We've got to stay strong in these times. I love it, guys. Okay. So Abby, my next question is directed to you. Nutrition is an important aspect of staying healthy. What advice do you have for people who out there regarding eating healthy?
Okay, so my advice is I hope you have a pen and paper ready because as usual, I have a list of 5 good foods that you can include to your diet starting from today. And you can get this food from your local grocery stores, online, your health stores, anywhere, really. So the first one is liquid chlorophyll. Have you ever heard of that?
I have. I'm in the industry, so I have. But you know, for everyone that's watching,
everyone else, yes.
What is that?
For everyone else that doesn't know what liquid chlorophyll is, so chlorophyll is the most important part of the plants. It's what gives it that green color. So when you see spinach, parsley, like kale, those green colored leafy vegetables, chlorophyll is the main ingredient in that. And it's full of lots of vitamins and minerals. So for people that don't like to eat vegetables, this will be a great thing to put into your diet because all you need is just 1 tablespoon a day. You put into your water and you can drink it like as one of your 400 or 500 milliliters of water a day to make up 2 liters. So you just put in your water and you drink it, and it promotes great digestion. It's like a natural deodorant. It's antioxidant, anti-aging. Like it's so good for you. So if you don't like eating vegetables, you can drink this one, and it has no sugar, no calories, nothing like that. So you don't have to worry about putting on weight drinking, because it say don't drink your nutrients, eat it, right? But this one you can actually drink it. And the second one is sea moss. I can't explain how good sea moss is. Sea moss has like 92 of the 110 minerals that your body needs. So all you need a day is 1 tablespoon. And the way that I implement sea moss into my diet is that I put into a smoothie. So I put like chia seed, sea moss, plant-based milk. So that can be almond milk or coconut milk, blueberries and mango. And I blend that up almost every day. I won't say every day, but almost every day. And that's how I implement sea moss into my diet. So you can do the same thing. You can have sea moss in your diet, and it's very easy. You can get it from your health food stores, online, but make sure you know where you're getting your sea moss from, because sometimes you have to know who your supplier is, because sometimes not all sea moss you see online are the best. So you have to know who your supplier is, and you have to trust them. And then the third food to put into your diet is apple cider vinegar. Apple cider vinegar is, yes, even though it doesn't taste the best, but you can always put it into your water and drink it. Because for me, I don't like plain water. Like I like putting stuff in it, right? So what you can put in is apple cider vinegar. Like it helps you to have glowing skin. It helps with your digestion. And if you have arthritis, it can help you. Like there's so many things that apple cider vinegar can do for you. That if you want more information, you can always like just type in benefits of apple cider vinegar so you can see for yourself how amazing this thing is. And all you need is just 1 tablespoon a day. Like you don't need that much. 1 tablespoon a day, put in your water, drink it first in the morning or before you go to bed, whatever you prefer. And that will help you to digest your food properly, because there's no point eating food if you can't digest it, right? If your body can't take the nutrients from the food to help your, to help you out. So there's no point of that. So it's best to put foods in your system that will help you digest your food, give you nutrients, and just help you out overall in your health. And then the fourth one is turmeric. Turmeric. I can't explain how much important this little spice is. Like, you can get it from your local grocery store. The bright yellow spice. You can put it into your smoothies. You can have this thing called golden milk, where it's like a hot beverage that you can make to help to boost your immune system. I give, like, whenever my kids get sick, this is what I give them, and it helps them to get better, like, fast, without any drugs or anything like that. Like, turmeric is your best friend if you want, like, your immune system to be on point. Put turmeric into your body. And the last one are the vitamins A, B, C, D, iron, calcium. Those 6 vitamins are really, really important for your daily health, because sometimes we don't get all the vitamins we need from our diet. So sometimes you do have to supplement, especially during the winter time. Vitamin D is very, very important for us, especially as people that have, like, more brown melanin in them. Like, vitamin D is important because the sun is not out during the winter as much as it is in the summer. So you have to make sure that you supplement vitamin D. It helps to boost your mood, because there's been studies that links, like, low levels of vitamin D to depression. So if you supplement with vitamin D, then you're less likely to have depression during the winter months, which is very, very important, because during the winter is when people get more depressed, because it's winter, it's cold, so make sure you supplement. Vitamin C also great for your immune system, especially now that we're going through this pandemic, and you need to make sure you supplement so your body can fight off whatever ailments come its way. You have things to help your body fight it. So vitamin C is very important. So foods like citrus food, those are vitamin C food. And just make sure you supplement, and put those foods into your system, and you'll be all right.
Wow. Thank you. So liquid chlorophyll, sea moss, apple cider vinegar, turmeric, and vitamins. You said A, B, C, D, and iron, right? Yeah. So many natural suggestions. Wow. Thank you, Abby. What natural remedies do you all use to do all of you guys use to stay healthy? I would just put that even to all of our attendees, just like, throw it in the chat. What do you guys do at home to stay healthy? Or were you not really too aware of any of these suggestions and now you're going to do them all? Throw it in the chat, engage with us tonight. Okay, guys. Amazing. I love that. Okay. So the next question is for Dr. Morgan. Would you advise engaging in outdoor activities at this time?
We want to be as active as possible, and we want to be safe at the same time as well. So I think being outdoors when we can be outside is a good way to be active. A lot of people are walking their dogs, or they're trying to spend some time outside with the fresh air and so forth. Always keeping in mind, of course, the public health guidelines and so forth. But we want to be active, and there's as both Abby and Wayne has shown, that there's lots of ways to be physically active indoors, so that you can always be active and support one another and maintain your health and your physical health and well-being. So that's critically important. But I think if you pick areas and spaces where you can go for a walk, and do some stretches or some exercises outside, that's good too. Because sometimes being in the indoors in your room or in your house or your condo or your apartment, wherever it may be, all day long, even that can be challenging and stressful. And you just want a change of environment, a change of scenery, and some fresh air and so forth. And spending a few minutes outside is a great way to do that. So yes.
Amazing. Yeah. I mean, get out there, go for a walk. I like to take my kids out. My youngest is only 9 months, but my oldest is 3 years. So, sometimes I just get the get her suited up and get a toboggan and, get her sliding down some hills and stuff. So, that's great. Definitely fresh air is so important. We all got to get out there. Now, moving on, Wayne, I would like to ask you another question. So having a workout routine while you're at home can be challenging. So what advice do you have for people that would help, them stay committed to working out?
Well, I do offer a online kind of training. It's like virtual training that will help to keep you motivated. And if that's not for you, then there's plenty of YouTube videos that are out there just to keep you on track. But the thing that I find that works the best is to change this right here. It's to change your mind, right? So I know like anybody has bought like fitness equipment or like, a brand new Bowflex. But then after a while, if you don't have that motivation, then it just becomes furniture. You hang up your jacket on it or your shirt, and then you just, stop using it after a while, right? So what you can do to stop all that from happening is just to change your mindset. Very important that you change your mindset to like give yourself some goals. So if you say this week you're going to do 5 push-ups, okay, you're going to do 5 push-ups. Then next week you do 6, right? Then you increase gradually, or you can join a group that does challenges. I've seen these ladies join this group that has, they say that they're going to do a minute plank on Tuesday. And then on Thursday, it's a minute and a half. Then they gradually increase it, or squat challenge or things like that, right? Those things, even though sometimes people find them, they could be boring. It's okay, it could be boring, but they do keep you on track, and they will, you'll see results if you keep it up for the long term. So yeah, you just gotta just change right here, and then everything else will follow, right?
Yes, amazing advice. I love that. I mean, for me, especially as a pro bodybuilder, I would love going to the gym, and it was a big shift for me to just work out solely at home. But it was in the mind first, right? I had to be like, it's okay. It's okay that I can't access a full gym. We can still get an excellent workout in at home. And I love that you're, offering online programs. That's amazing. So I would encourage anybody, if you're struggling to stay committed to a workout, go check out Buff Boy Fitness, go see, what online, offerings Wayne has, because it's a great accountability, like just having, a program that you can follow. So amazing. Thank you so much, Wayne. Thank you. So our next question is directed to Dr. Morgan. So Black people have, disproportionately, I think, been affected by COVID-19. Statistics from the City of Toronto revealed that 21% of reported cases affect Black people, who make up only 9% of the city's overall population. So Dr. Morgan, you founded the Black Health Alliance to improve the health and well-being of Black communities in Canada. What can the government do to address this disparity?
There's a lot that can be done and should be done. Not only, COVID-19 has highlighted existing, long-standing disparities in health that Black people have been having to face the burden of for many, many years, whether that be hypertension, diabetes, sickle cell disease, mental health, and so many other conditions. So these disparities have been around for a long time. And the current pandemic has really just exasperated, sort of like turned up the volume on these disparities. There's a lot that government can be doing and should be doing, as well as what I think and what Black Health Alliance has been doing is really supporting that what the community can do as well. One of the things that we have to start doing on the government side of things, and we've been pushing for that, is better data, better research and better data collection. So for example, in the US, you can answer the question, how many people of African Canadian or African American background between ages of 25 and 45 male contracted a prostate cancer last year, for example. We don't have the answers to those type of questions in Canada because our healthcare system isn't designed to pick out and that type of data. We don't collect information that includes race and ethnicity and a lot of those other social economic status, income, household, and all those other kind of things. And that's critical because what it means is that we're not able to properly identify which groups, what communities are being hit the hardest. And if we can't identify or track or measure which groups are being hit the hardest, then you're not able to show change over time. And so one of the things that the Black Health Alliance and a number of other community organizations have been really pushing the government, and there's been some change in terms of better data collection and research. So we need to be able to gather that data properly. Equity is a big thing, and addressing anti-Black racism is a big thing, because you'd be surprised the impact of systemic anti-Black racism that has its impact on health and well-being, whether that be in the criminal justice system, in education, in housing, in employment, and in healthcare. So training and education. So a lot of these type of changes that we are seeking to have are going to require changes at a policy system level. So changes in how the training of doctors and nurses. I can give you an example in sickle cell, for example, in sickle cell disease, which is a inherited blood disorder, which does tend to affect people of African descent, not exclusively, but there's it's quite common in that community. In many cases, some of the doctors and nurses, the training and education about how to properly treat from a medical perspective people that have sickle cell disease is inadequate, and that leads to poor outcomes for people living with it. There's stereotypes that they feel that they may be drug seeking and so forth. So there's a lot of education, a lot of retraining that needs to take place. And the Black Health Alliance, along with other groups in the community, have been trying to work with health agencies and so forth, and governments in particular, to get these things done.
Wow. Thank you for sharing that with us. I mean, that really helped to shed some light, on some things that, essentially the Black community is facing in terms of their health. I would just want to encourage everyone at this time, if you have any questions, for Dr. Morgan, please post them in the chat, as we will have a discussion coming up shortly. Okay, so moving on, I wanted to pose another question to our panelists. So let's talk about vaccines. There's been a lot of talk in the news about vaccines. So some people in the community are not planning to take it, while others are going to take the vaccine. Are you going to take the vaccine? What is your take on this? Let's start with Wayne.
Well, at this time, I don't want to jump in front of the line. I want other people to be able to get the vaccine first. The elderly, the healthcare workers, the people that are most at risk. I would be considered low risk right now. Mm-hmm. So I'd like to see others get the vaccine first, and then decide on getting mine later.
Yes. Okay. All right, Abby, how about yourself?
Okay, so in regards to the vaccine, I strongly believe, for me personally and for my family, we would like to wait just a bit for more data to become available, so I'm more aware of the side effects and the benefit of it. Because, like Wayne said, I'm low risk to I'm not like up. What's the word I'm looking for? Like, it's better for people that really needs it to get it, because they don't have enough for everyone to get at this point, right? Mm-hmm. So it's better for people that really need it to get it, so their lives can be saved. For me, I believe I'm low risk because I'm younger. I take my health very seriously, and if I do get COVID, I hope that I'll be able to fight it. But at this point, I would like to wait for more data before I can say yes or no to the vaccine at this point.
Dr. Morgan, how about yourself?
This is a critical question, and that's currently there are a number of town halls and discussion tables around the vaccine, and in particular as it relates to the Black community, because we know that the incidence of COVID-19, the number of hospitalizations, it's 1 in 4 families, it's high. So it's a question that the Black community has to address. I think it's critical, number one, that we have adequate, reliable, credible information about the vaccine, about its side effects, about its doses and so forth. That's very, very important. It has to come from trusted resources. There's a lot of information out there. We know that, and the attitudes around the vaccine vary from one end to the other. So I think we have to understand that for many people in our community, there's going to be some hesitancy towards taking the vaccine. Historically, there's been some clear, well-documented cases where vaccinations or of people of African descent and so forth have not been to the benefit of Black people, and people are aware of this. And I also think within our community, there's a natural inclination to things that are natural and so forth, as when there's taking medications and so forth. So we have to respect and understand where people are and that history and how that will impact people's opinions around whether they should take it or not. So providing good, reliable medical information is important. And I think, I've had conversations around this with other members within our group and so forth, and I've seen attitudes change. I remember one colleague, young person, and she was saying I'm not going to get it. I don't want it. I don't trust it and so forth. And then someone close within our family got it, COVID-19. Then she contracted it a little while later. And in a conversation with her just 2 weeks ago, she said, her perspective has changed. She would now advocate and encourage other people within our community to take it. So, as if it comes home and it comes into you close at home, sometimes that will change perspectives and so forth. Overall, vaccination is one part of a broader strategy, of a broader long-term strategy. It's something which will provide support for certainly those people at high risk.
Okay.
If the Black community is vulnerable or has vulnerabilities to COVID-19, when you ask yourself, well, why is it so high in our community? That's the question that you need to ask. Why is it? Is it because of our housing situation? Is it because of our employment situation? Are we in jobs that are more at risk? What are the situations that create a higher vulnerability in our community? And then the vaccination needs to be a consideration as one part of a broader strategy that's going to address the factors that make us vulnerable in the first place. And that's what needs to take place. So if you're looking at the things that create our community at greater risk, we need to address those root causes, right, long term, and understand that vaccination is maybe a viable option for the short term for many people where it's appropriate.
Wow. And so speaking a little bit more about now the Black community. So, you had mentioned just the vulnerability. Now we know that Black people are disproportionately affected by many diseases, such as sickle cell, which you mentioned earlier, diabetes, heart disease. So what are some of the ways that the Black Health Alliance brings awareness to this? And how can these diseases within the Black community and their impact sort of be addressed?
There are a couple of ways in which we've tried to address this. The first is community engagement on the ground. So that's providing information, health promotion, health education. So for example, what that looks like, we've done numerous over the past 20 plus years, health forums, whether that be in churches, whether that be at community centers. So we talk about, the Black Diabetes Expo, the Taste of the Caribbean and Africa Food Expo for many, many years. We've been at AfroFest, where we had a number of the other organizations that address with mental health, with diabetes. We had blood pressure screening. So going directly where our community is, providing information, trying to, accurate, credible information about the signs and symptoms about these various conditions, letting them know where they can go for help from organizations that are there to provide services to our community in a way in which we understand the cultural, ideology and tendencies and so forth of our community, so that information can be presented in that way. That's number one. We've done like a Black Health Challenge for both men and women, and where you're looking at a program that incorporates healthy living and nutrition, where you can adapt and follow your own cultural foods that are healthy, but you're just with the advice of trained nutritionists and dietitians and so forth, that you can eat in a healthy way and still be able to lower your risk of hypertension or diabetes and kidney disease and heart disease and stroke, which is so high in our community. So that's one. So that's sort of on a community direct health promotion, health education point. Then the next level is where we try to make some systems change. So where we're now looking at policy changes that are going to affect people in mass numbers. Examples I can give you of that is when we work closely with the sickle cell community to get newborn screening as a part of for every child born in the province of Ontario. Since about 2004, 2005, their child is screened for sickle cell disease. And what that allows is that both the family and the parents will know whether or not their child has a sickle cell trait or the disease itself, and they can directly be tapped into supports within the community and within the hospital setting to be able to know what to expect and to get the type of counseling that they're going to need going forward and so forth. So those are the type of system-wide changes which will have a huge impact on literally tens of thousands of people in our community. Another one, an example, the Black Health Alliance, we worked hard with the government to establish Taibu Community Health Center. That's a community health center located in the Malvern area in Scarborough. And that is one of the only publicly funded health centers which has a mandate to serve the Black community. And there's doctors, there's nurses, there's social workers, there's dietitians, there's chiropodists, there's chiropractic, there's all kinds of primary healthcare services, as well as social programs. There's seniors programs, after school programs for youth and young people and so forth. And what we're trying to do there is being able to change the health landscape, where we now have centers that are designed and there specifically to address the needs, the health and well-being needs of our community. And we're working, so, next step is to really be able to multiply and duplicate that in other parts of the province. We're working right now on a mental health strategy, looking at the mental health and addictions for children and Black families and children and youth across the province of Ontario. That's a 5-year project. We're just on about 2.5 ways through that. Wow. So what we're moving on is really trying to get system-wide changes that scale up the interventions so that we can hopefully have real impact. So doing research, health promotion, affecting policies, addressing anti-Black racism. There's a lot of that. That's what we've been doing, and working with some great stakeholders, a lot of talented people in the community. And the past year has shown we've had a lot of support and looking for good things going forward.
Amazing. And so that was the Taibu Community Health Center, you'd said, right? TAIBU, is that correct?
That's correct.
Is that how that? Yes. Okay. Wonderful. So I definitely encourage everyone listening to this call to look them up on Facebook or even visit their website. You can just pop that name Taibu Community Health Center into your Google search. Okay. But that's amazing. And I think that prevention as well is so much better than trying to find a cure. So if we were all to be proactive and implement these things now, what are some things though that you would tell people to start, to stop, or to continue in terms of maintaining a healthy lifestyle? I'll ask Abby first.
I'm going to be a little bit biased because I'm vegan. So,
okay.
So the one thing I can advise people to lower a bit is the eating of meat, right? The reason why I'm saying that is because meat has been linked to a lot of, like high blood pressure, cholesterol, all these things that are, diabetes, so I feel like you need to implement more fruits and vegetables into your diet. It's very, very important that you do that for yourself, because that will help you to build up your immune system, for one, and it will help you to avoid getting like diabetes, the high blood pressure, the high cholesterol, and the diseases that plagues like the Black community that's diet related. So I'm not saying stop eating meat, but at least lower it. So if you're used to eating meat like 5 to 7 times a week, try to cut it down to about 3 to 2 days a week, or if you're used to eating meat like 3 times a day, just cut it out in your breakfast and your lunch and just have it for dinner. Everything is moderation. Like, don't overdo it, and just try to implement more fruits and vegetables into your diet. It's very, very important. So that would be my tip for you today.
Amazing. And so I'll just throw this one to Wayne quickly, because we do want to do a little bit of Q&A. So Wayne, what would be your input here? What are some things you would tell people to start, stop, or continue in order to maintain a healthy lifestyle?
Well, what I like to say is movement is medicine. Movement is medicine. You got to get up and start to get your body moving, right? If you have a car in the garage and you never drive it, don't expect your car to work, right? So that goes same with our bodies. We still just got to keep moving. Just keep moving. And just remember that movement is medicine.
Amazing. Thank you so much. Okay. And so just very, very briefly, I will also ask you, Dr. Morgan, what would you recommend people to start, stop, or to continue for maintaining a healthy lifestyle?
You want to get rest. A lot of what's already been said is I think is important. Getting adequate sleep is also a lot. Many of us are sleep deprived, and we want to stop procrastinating as best as we can, use our time efficiently, get the rest, exercise, sleep, all the other stuff that Abby and Wayne have been saying. I support 110%. Get support. Get support. Friends, join a group, a challenge group, the accountability, the socialization, that helps you with your motivation. And reach out to people. Self-care, we have to really, no man or woman is an island. Let's reach out, get the support, and together we'll make it through.
Amazing. Thank you so much for your input, guys. So moving on to the Q&A, I have some questions here. First one, I'll pose this to, really anyone, but I think Abby or Wayne, if one of you two want to field this one, how many minutes of exercise are we expected to have in a day, and what kind of drinks should be avoided?
Okay, so to answer that question, I would say at least 45 minutes of working out a day. 45 minutes. Now, when I say of working out, doesn't necessarily have to be like pumping iron or push-ups or anything, even walking, right? At least 30 to 45 minutes a day, that will help. And to avoid, I would say sugary drinks, pop drinks, carbonated drinks that are full of sugar, and refined sugars, right? So you want to just eliminate those so that you can keep a nice physique, and you can get your weight down and start to feel good for the spring and summer, right? So yeah,
amazing.
So sugary drinks and just start moving more. That's all.
Okay, awesome. And I mean, whether or not we're gonna get to a beach this summer, still, wouldn't it be nice to have a beach body?
Man, I'm optimistic. I'm trying to keep it real, man, because if you keep it in your mind that you're never gonna go out, then you'll never go out. Right? Yeah. So, hey, man, stay positive. You'll get there.
Yes.
You're on the beach.
Awesome. Awesome. So the next question we have here in our Q&A, I will pose this to Dr. Morgan. So what is the role of behavioral health specialists in this era of lockdown. Can exercise reduce fear, frustration, panic, and depression that might arise from restriction to movement?
I think exercise is important. Movement is important. These are all strategies to help alleviate anxiety, depression, stress. These are stress management coping strategies. So we need to, if there are folks that can help people change the way we think and change our perspective on the challenges that we're facing on a day-to-day basis, that can be significant in terms of helping us make it through. And so definitely you want to seek the support of experts in the field that can help give us the tools to overcome the challenges that we're facing. So movement, exercise, these are things that that help with stress, anxiety, and can help us get through. So I think it's a good thing to consider.
Okay, amazing. And so I even want to just throw this one back to Wayne. We had another question along the same lines, but how can people avoid going into depression, especially those that live alone? Maybe you can talk a little bit again to the importance of exercise and movement, Wayne.
Okay, so when it comes to depression, there's two things that you can do. Number one is to get outside, of course, because you need that vitamin D to help, get your hormones back to feeling normal again, right? And then number two is, I know it's going to sound weird, but eat more bananas, right? Bananas, it actually helps because it has two things in it. It's tryptophan and vitamin B12. When you combine those two, they help to stimulate a hormone in your brain. The hormone is serotonin. That's it. There's serotonin, and there's one more. I can't remember the name of the hormone, but it helps to make you feel happy again, right? And the way that I remember this is that a banana is yellow, like sunshine, and it's in the shape of a smile.
Amazing. Thank you. And so, Abby, Wayne just mentioned, vitamin D helping to combat depression. If I feel like you guys are just, one and the same, like you guys are like so like interconnected, because I could just I'm hearing him talk and I'm seeing like how you probably influence even his, him with your knowledge of nutrition. That's amazing. So do you have anything to add what Wayne had just said? What are some things people can do even nutritionally just to combat depression? What do you think?
Okay, so what you can do, like Wayne said, banana, also avocado. Eating avocado helps to boost your mood. There's actually a smoothie recipe that I shared on Synergy, which is on AFROGLOBAL. It's avocado, banana, and I believe it was turmeric and sweetener of any one of your choice. So it can be honey, agave, whatever, and then milk, plant-based milk. So almond milk or coconut milk. So you can make that smoothie for yourself, and that will boost up your mood because banana, avocado, all those ingredients, turmeric, have been linked to boosting up your mood and helping you feel good about yourself. And of course, exercise helps too. Like if you live alone, just find a support group, like Dr. Morgan said, like call one of your friends on FaceTime or on Zoom or whatever. You guys pick a time, say, let's meet around 4 today and let's work out or talk about our day, just have that social aspect in your life if you're alone. So that way you don't feel like depressed or, oh, what am I living life for? Something, you have something to live for. So just do that. Make time for your friends, call them, and eat healthy. Like I said, avocado, banana, all those things, and exercise. So those things will help you if you live alone to help you to combat depression.
Amazing. And for anyone that's interested in that smoothie recipe, it's going to be posted to the AFROGLOBAL YouTube page. Okay, so just take a look at that and enjoy. Okay. But I love, what you just said there, Abby, about staying connected. It's still possible, right? Like, we're using Zoom as a platform right now to, basically disseminate this information and to reach people, and I find that a lot of even fitness and health professionals right now are using social media platforms and creating groups on Facebook, and there's community there, so if you want it, you can find it. You just have to look, right? But it's right there at your fingertips. Get onto a community, whether it's a community based around nutrition or around health, or a women's community or whatever it may be. It's there for you. It's out there, right? So you can definitely find that. I love that. Wayne, this one is for you. Now, what type of exercise is good for a tropical climate? So I'm guessing our attendee today lives in a hot area. So what can you do I know, I wish I were there with you. It's very cold in Canada.
Oh, you're so lucky. Whoever is asking this from a tropical country. I envy you. But what you can do in a tropical place where you want to get enough resistance is running on the beach. Now, I haven't been able to do that in a few years, but once this whole thing and I'm able to travel, definitely I will be on the beach running. And the beach, what it does is it gives you just enough resistance. So it's not just like running on a treadmill or running on the street or anything like that. It gives you just enough resistance so that you can really build up a really good sweat. And when you're done, you could just jump in the water. Boom. I'm getting jealous.
I know, I love that. And you know what? So we touched a lot on other aspects of health, but we know that mental health is a big thing right now because of we're in isolation and we're so accustomed to having a lot more freedoms, being able to meet with friends, family, go out, to restaurants, the mall, these types of things, go to the gym, right? So I want to ask, each of our panelists, what are you all doing to maintain your mental health? And what would you all recommend your clients or patients do to take care of their mental health during this time? So I'll ask Abby first.
I've been lucky that I have a large family that lives with me. So I haven't really been through like the struggles of mental health. But my advice for someone that's going through that would be to reach out to people, because sometimes it's hard to reach out. You feel like you're the only one feeling this way, or no one will understand you or get what you're going through. But I promise you, if you reach out to a friend, a family member, a pastor, or even like your doctor, like your family doctor, you can reach out to them and just explain what you're feeling, and they'll be able to help you with resources and on how to get over the depression or build up your mental. And I've always believed that your mental is also tied to your nutrition, right? It's what you put in your body also matters. So you have to make sure that you're putting in food that will build up your body, your system, your mental, your emotional, and everything like that. So that way you don't really go through the depression or the mental issues that usually comes during the winter. So nutrition, food will help you out a lot when it comes to getting ahead of your mental health. That's my advice.
Amazing. Thank you so much. And Wayne, what's your input on maintaining mental health? What are you doing, and what would you recommend for your clients to do?
Well, I've been very fortunate enough to turn a room in my house into a gym. So whether you can see this, I don't know, but this is
I can.
a gym, right? And
I love is that purple lighting? I love those.
It is purple lighting just for ambiance, just to keep the mental, good. And it gives me like that feel where I feel like I'm in a hotel or so. I got some weights here, you know what I mean? So I've been very fortunate in order to, just to keep active, because if I didn't have this, then I would just be at home with Abby and the kids and just, maybe Netflix, maybe. But, like, it helps, just to stay active.
You make me sound so bad. Like,
no. I love it. I love it. I love it. I love you, boo. I love you. But I got cardio here too, so that always helps. And like weights and like a squat rack and all that stuff. So that's how I've been able to keep like mentally sane and good conversation with Abby. We bust jokes all the time. We watch movies. We still play with the kids, like kids are in their room right now. But we've been able to like just stay active and just, encourage each other, because there's a lot of people out there that don't have that. And, they don't even have access to like even weights or anything like that. So I've just been very fortunate. And yeah, just staying active, keep moving. Right?
Wow, amazing. Thank you so much. And you know what? I would have to say, at home with Abby, you can't go wrong. I mean, come on, Wayne, you've hit the jackpot here, right?
Thank you.
Look, you can't go wrong. Okay, guys, and just to add to what you're saying, Wayne, some people may not have all the space to make their own gym or even like have access to equipment, but you guys, your video was excellent. You're using things in the home. So, no excuses, right? Like everyone just needs to carve out a little time, make a little space in their house, and you can get a workout in, and you can definitely, stay on top of your eating, just implement some of the things that Abby has shared today. And, we can all still, achieve our optimal health and maintain good mental, physical, spiritual health, while we're on lockdown, right? Okay, guys, so I just want to thank everyone who joined tonight. Honestly, tonight's webinar has been amazing. We have these amazing panelists. Thank you, Abby. Thank you, Wayne. Thank you, Dr. Morgan. Love the energy, guys. Thank you. And yes, thank you, Patricia and Moses and everyone at the Transformation Institute. This has been an amazing and insightful webinar. All right. Good night, everyone.
What is behind the racial inequalities in our education system? Join us for a webinar on systemic disparities in education for Blacks and other students of color. Panelists, Dr. George Sefade, renowned educator, researcher, and author. Kathy McDonald, trustee, Peel District School Board. Warren Salmon, President, Ontario Alliance of Black School Educators and CEO of First Fridays in Canada. Moderated by Iyanu Akinranola, educator and community advocate. Friday, February 12th at 6 p.m. Register at eventbrite.ca. This is a part of the Community Resilience Program. Visit us at transformationinstitute.ca.
AFROGLOBAL Television is a global super channel that transforms the destiny of people of African descent through programming that informs, empowers, entertains, and uplifts. The mission of AFROGLOBAL is to showcase the best of Africa and the diaspora. Watch AFROGLOBAL Television on Rogers Cable, Bell 5, TELUS, and Eastlink.
In 2008, we felt that it was important to start a program to reach out to young people in our community because there was a lot of violence And there was just so much going on that was not positive about Black youth or youth in sort of disadvantaged neighborhoods. So we started a crossover mentorship program to reach out to these young people, to bring people that look like them, to share their experiences with them, to let them know that, you know, they're not alone in whatever they're going through, that somebody else has probably gone through the same experience. And like Maya Angelou said, when you learn, teach. When you get, give. And that's what the program is all about.
If we don't catch them early, they could be falling into the wrong hands or into the tracks that we don't want them to be. They have to be contributing to the society, not the other way.
It's important to have a mentorship program like this in the community because a lot of the time people are focused on their own lives and a lot of the time it's very separate. This actually lets people come together and learn from each other.
Kids nowadays, I think they spend too much time on the devices. They don't talk enough. Everything is a machine. And the ability to communicate, I mean, we have to go out and work and deal with other people. So I think any interaction where they have to learn to deal with other people, going to school and doing activities that they enjoy doing, I think you're gonna have a lot of success, but it's also a great teaching tool.
See, I can't afford to sleep till 7 o'clock, and people think you do, but discipline is important.
This mentorship program is really very significant simply because it ensures that our young people, our youth, who are the future of this country, it's obvious, need to be able to participate. We have for them to open up the system more and make it equitable and for them to easier able to access that field of employment and education. What the Institute is doing along with the program is to ensure that students and young people can reach their potential.
It gives them career coaching where they can learn the difference between a job and the difference between a career, knowing that a career is something that's more long-term versus a job is something that you just may do to pay the bills, to get by. And also during that transition from being a youth to an adult, which is very key and it's an essential part of growing up. And also it provides them with mentors that can give them not only the guidance, but give them the tools they need to be successful in life.
Hi, my name is Baladi Ajamali, and I was part of the Rio 2016 4x1 team with Andre DeGrasse. We won a bronze medal last year, and I was also part of the crossover mentorship program in 2008. Being a part of that program has changed my life and made me a better person today. So I challenge you to come and join this program.